Well, Keenan, this mass vaccination site here at TCF Center giving the city a little bit of a leg up, according to the city's health department. Just yesterday, Detroit passed a major milestone, 70,000 vaccinations at TCF Center alone, which has the capacity to service around 4,700 cars a day.
This has been running very smoothly.
Annette Moorhead and her husband were at TCF Center yesterday getting their second dose of the vaccine. The line running pretty smoothly.
We've scheduled out for several weeks. It's just a matter of looking at different ways to make sure that access to the vaccines are available.
It's one of the reasons the city expanded its vaccine eligibility last week with the Good Neighbor program. Getting Detroit seniors transportation has been part of the challenge.
When the vaccines first rolled out, the majority of them went to the healthcare systems. That really knocked down a chunk of individuals around the counties. However, Detroit was just a little bit out of that loop there, so that's why we had to really boost our efforts.
The city pushed for more vaccines for its mass distribution site and its outreach sites on the weekends. There are now 6. Here's a look at doses distributed by the state so far to major jurisdictions in Metro Detroit. Keep in mind the jurisdictions can include hospitals, health departments, and other federally qualified health systems. Detroit leading the way with more than 202,000.
They are doing a good job. They're ahead of the game.
But when you look at percentage of the population vaccinated, Detroit's just above 10%, according to recent state data, lagging behind the state and surrounding counties like Washtenaw, almost double the percentage of people vaccinated.
Besides our residents, Detroit has some large employers, so we have that responsibility to ensure that they are offered the opportunity to be vaccinated as well as they interact with Detroiters.
So, Jen, one of the real questions here that people are asking all over Michigan is how does the state decide how many doses to send to each jurisdiction?
That is a multifaceted answer, Keenan. You may remember in the beginning of the vaccine rollout, the main priority was frontline healthcare workers, and that's why so many doses were allocated to health systems. Now, moving forward after that, the state considers a lot of factors in determining how many doses go to each individual county. They consider things like the population in that area, also social factors such as poverty, hospital populations, the population of certain frontline workers, and those over 65. So it's not just one thing, Keenan. There are a lot of factors that the state considers on that front.
And Jen, before we let you go, we talked about the Johnson & Johnson shot being rolled out. Do we know when that could be available in Detroit?
We don't have a hard date yet. I did ask the city about that yesterday. They say logistically it will be a little bit challenging because, of course, the Johnson & Johnson vaccine is a single dose shot. And as of now, the Moderna and Pfizer vaccines here at TCF Center, those are the ones that are offered. Those are double dose shots. So logistically, things will work a little bit differently if and when Johnson & Johnson vaccine comes here. That's expected, though, sometime in the near future. Keenan?